If you're over 60 and dealing with knee pain, there's a good chance you've been told the same thing over and over again. Just stretch more. So you stretch your quads. You stretch your hamstrings. You stretch before walking. You stretch after walking. And yet, your knees still hurt. Some days, they even feel worse after stretching. And that's incredibly frustrating because you're doing what you were told was the right thing. Here's the part most people never explain. After 60, knee pain is often not caused by tight muscles alone. And the knee joint, unlike hips or shoulders, doesn't always respond well to aggressive stretching. In fact, for many people, pulling hard on a sensitive knee can irritate the joint, increase inflammation, and make the area feel more unstable, especially if the muscles that support the knee are weak or inactive. That's why so many people say things like, "Stretching doesn't help me anymore," or "My knees feel looser, but not better." The good news? Relief doesn't usually come from forcing the knee to stretch further. It often comes from gentle, controlled movement that improves circulation, wakes up the supporting muscles, and tells your nervous system that the joint is safe again. In this video, I'm going to show you 3 simple movements that many people over 60 say feel better than stretching, sometimes immediately. They're safe, they're gentle, and they're designed for knees that need support, not punishment. The big myth: knee pain is not just tight muscles. One of the biggest myths about knee pain after 60 is the idea that it comes mainly from tight muscles. That belief makes sense because tightness feels uncomfortable and stretching seems like the logical solution. But in most cases, knee pain has very little to do with flexibility alone. The knee is not a muscle. It is a joint that depends on support from the muscles around it. After 60, knee discomfort is usually linked to 4 main issues. First, poor joint support. When the muscles around the knee are weak or not firing, while the joint has to absorb more stress with every step. Second, weak stabilizing muscles. Small support muscles around the thigh, hip, and ankle help keep the knee aligned. When they are inactive, the knee can feel unstable or sore even during simple movements. Third, reduced circulation. Movement helps bring nutrients and lubrication into the knee joint. Long periods of sitting or very limited motion reduce that flow, which can increase stiffness and discomfort. And fourth, nervous system sensitivity. As we age, the body becomes more protective. If the knee has felt pain before, the nervous system may tighten and guard the area even when there is no real damage. This is why stretching does not always help. Pulling on a sensitive joint can increase irritation instead of relief. What the knee often needs is not more stretch. It needs better support, better movement, and clearer signals of safety. That is where gentle, controlled movement becomes far more effective than forcing flexibility. Why gentle movement often feels better than stretching. If stretching has stopped helping your knees, there is a good reason for that. The knee joint is designed to move, not to be pulled on aggressively. When you move the knee gently and repeatedly, something important happens inside the joint. Movement helps spread synovial fluid. This fluid acts like natural oil for the knee. It reduces friction and helps the joint feel smoother and less stiff. Stretching does not create the same effect. In fact, long static stretches can sometimes leave the joint feeling more irritated, especially if the surrounding muscles are not active. Gentle movement also improves circulation. Blood flow brings oxygen and nutrients into the tissues around the knee. This supports healing and reduces that heavy, achy feeling many people notice after sitting or first thing in the morning. Just as important is what happens in the nervous system. Slow, controlled movements send a message of safety to your brain. They tell your body that the knee is stable and supported. When the nervous system feels safe, it relaxes. And when it relaxes, pain often decreases. This is why pain does not always mean damage. Many knees hurt because they feel unprotected, not because they are broken. When you move slowly with control, you wake up the muscles that stabilize the knee. You improve joint lubrication, and you calm the protective response of the nervous system. That combination is why gentle movement so often feels better than stretching. What these 3 moves do differently. Before I show you the movements, it is important to set the right expectations. These are not intense exercises. They are not stretches that push your knee to the end of its range. And they are not about working through pain. Every movement you are about to see is slow. It is controlled. And it stays within a range that feels comfortable for your body. If something causes sharp pain or makes your knee feel worse, you stop. That is not a failure. That is your body giving you useful feedback. The goal here is not to force change. It is to allow the knee to feel supported and safe again. These movements are designed to wake up the muscles around the knee, improve circulation in the joint, and restore confidence in simple, everyday motion. You should finish feeling better than when you started. Not exhausted, not sore, and not afraid of moving. When exercise feels safe, people are more consistent. And consistency is what actually improves knee comfort after 60. Comfort first. Control second. Intensity last. Move 1. Supported knee bend, pain-free range. This first movement is one of the simplest and most effective ways to help knee pain after 60. It is not a stretch. It is not a squat. And it is not about going deep. It is a gentle supported knee bend done in a range that feels comfortable. This movement helps knee pain because it increases circulation around the joint. It encourages synovial fluid to move through the knee, and it wakes up the muscles that support the knee without placing stress on it. Many people notice their knees feel warmer, smoother, and less stiff after just a few repetitions. Here is how to do it safely. Stand next to a sturdy chair, counter, or table. Lightly hold it with one or both hands for balance. Place your feet about hip-width apart. Now slowly bend one knee just a little. You are not trying to squat. You are simply allowing the knee to bend in a pain-free range. Then gently straighten the leg again. Move slowly and smoothly. Repeat this motion several times before switching sides. Common mistakes to avoid. Do not force the knee to bend deeper. Do not bounce at the bottom. Do not rush the movement. If you feel sharp pain, stop immediately. Beginner options. You can keep most of your weight on the straight leg. You can bend the knee only a few degrees. You can use both hands for full support. How this should feel. You should feel gentle movement, mild warmth, and a sense of easing, not strain. There should be no sharp pain, no pressure inside the joint, and no feeling of instability. This movement is about reminding your knee that motion is safe. That feeling of safety is often the first step toward relief. Move 2. Heel slides or seated knee glides. This second movement is especially helpful if your knees feel sore, stiff, or uncomfortable when standing. It is done without putting weight through the knee. And that is exactly why it often feels better than stretching. When the knee is not bearing weight, there is no compression through the joint, no pressure, and no forcing. This allows the knee to move freely and smoothly, which is ideal for sensitive knees after 60. Heel slides are powerful because they gently move the knee through its natural range. They improve circulation. They help synovial fluid spread through the joint, and they reduce stiffness without stressing the knee. Here is how to do them. Sit on a chair or lie comfortably on your back. If seated, place your foot flat on the floor. If lying, keep your leg straight to start. Slowly slide your heel toward your body. Let the knee bend only as far as it feels comfortable. There should be no forcing. Pause briefly, then slowly slide the heel back to the starting position. Move slowly and smoothly. Repeat several times before switching legs. Range control is very important. You decide how far the knee bends. If today that range is small, that is perfectly fine. Comfort always comes first. When to stop? Stop if you feel sharp pain. Stop if pressure builds inside the knee. Stop if the knee feels unstable. This movement should feel easy and controlled. Who benefits most from heel slides? People with arthritis. People with morning stiffness. People whose knees hurt after sitting for a long time. And people who feel nervous loading their knees while standing. This movement helps restore confidence. It reminds the knee that movement can feel safe again. Move 3. Gentle quad activation without knee stress. This third movement focuses on the muscles that protect the knee more than almost any others. The quadriceps. The quadriceps are the large muscles at the front of your thigh. Their main job is to support and stabilize the knee. After 60, these muscles often become weaker or less active, not because people are lazy, but because pain causes the body to avoid using them fully. When the quadriceps are weak, the knee joint has less support. That makes everyday movements feel harder and more uncomfortable. This is why strengthening around the knee often reduces pain more effectively than stretching the knee itself. The key here is activation, not strain. Here is how to do it. Sit comfortably on a chair or lie on your back with one leg straight. The other leg can stay bent for support. Gently tighten the muscles on the front of your straight leg, as if you are pressing the back of your knee down into the surface beneath you. Hold that gentle tension for 5 to 10 seconds. Then fully relax. Breathe slowly and naturally. Do not hold your breath. Repeat this several times before switching legs. The movement should feel very light. There should be no knee pain, no joint pressure, and no shaking or strain. This activation tells your brain that the knee is supported. It improves joint stability, and it helps the knee feel more secure during walking and standing. Breathing matters here. Slow breathing helps the nervous system relax, and a relaxed nervous system allows muscles to work more efficiently. This movement is especially helpful if your knees feel unstable, or if pain appears during walking or standing up. Strong calm quadriceps help the knee feel safe again.